Hello, my name is Marisol Fritchie and I'm a nursing level 4 student.
And hi, my name is Jamie Ray and I'm also a level 4 nursing student. And we want to welcome you to the Kingwood Hospital today, and we are going to be discussing the patient environment for you.
There is a push button for the bed, just for the bed to make it up and down, and you can push this for up and you can push it for down. And there's also the other side. There's if you want the head of the bed to be up, you can push it. There's a sign of the head right there on the side that you can push it up and you can push it also down. That's up and that's down. When you want the foot of the bed to be up and down, there's also a picture right here in the side of the bed, both rails. You can push it up and you can push also down.
Okay, there's also bottom rails on your bed, and these are not electronic, but what you're going to have to do is actually pull the rail out and up, and it will lock into place. Then to put the rail down, you're going to be pushing the black button. It's push, and the rail will go down.
The bedside of the bed has a drawer, and the drawer contains of a pitcher, a Mrs. basin if you need it, the bedpan, and the urinal. It has also the EKG, but only Miss Jules is going to use this one, and the control for the mannequin. The trash can is right here. The whiteboard is right here. After we assess the patient, we're going to write our name, the date for today, and the patient blood pressure or vital signs in here. The sharp container, which is the orange color, is right here. Please be careful, only sharp is going here. Switch light is right here for the control if you want this.
Behind the patient's bed, you will have an electrical outlet, an oxygen apparatus, a suction container, along with 3 different sizes of gloves that may be needed. There's also a blood pressure cuff and a curtain for privacy if it needs to be pulled. The patient also has a blood pressure cuff on their arm that can be used if necessary. Some other devices that you may need during your assessment of your patient that you're going to have to obtain from the nursing station. First, you have your thermometer. This is a tympanic thermometer. You will have a pulse oximeter, and you will have a glucometer to test the patient's glucose. So when you're actually using these devices on your patient, you have to remember, although this is your patient, it is also a mannequin, and you may not be able to get a true reading as far as the temperature goes, or the pulse ox, or the glucometer. So at that point, as you're using these apparatuses, let's start with first the thermometer. This is a tympanic thermometer that, when placed into the patient's ear, at that point, when you need a temperature, you're going to need to call out to Miss Gerald so that you can get a temperature reading from her. The next device will be the pulse oximeter, which is going to be placed on the patient's finger. And again, you're going to have to call out to Miss Gerald's to get a reading for the pulse ox. And the last device is the glucometer that you will need to set up with the, you're not actually going to be lancing the mannequin, but you are able to use the alcohol swab, and you will be able to show the process of lancing the patient, taking a sample of the patient's blood, and then calling out to Miss Gerald's for the actual glucose reading.
For emergency, if you need CPR, There's the push red button right there on the head of the bed to have a quick head release.
Okay, so you can drop the bed and then remove the foot of the bed. And this can be placed underneath the patient or a backboard. Which can be done if needed in an emergency situation. Okay, so you also have a curtain for privacy. You can notice it wraps all the way around the patient's room. And so all you need to do if you want to replace it is to pull it back. And it can be placed in its original position.
Thank you for joining us during the orientation of patient environment. We hope that you enjoy this virtual experience. Good luck! All right.